What's up, everyone? My name is Chris, 27 years old. I've been diagnosed with lymphoma cancer, stage 1. Reason I'm making this video blog is kind of to keep my friends updated on my situation, how all this came to what it is today, and how my treatments are going. About 3 months ago, November, I had a lump on my neck. Nothing too crazy, just a little lump. Caught my attention though. Brought it up to my wife and caught her attention as well. We decided to keep an eye on it before we went to the emergency room, before we started freaking out or anything, mind's going all over the place. So we kept an eye on it for a couple weeks. Noticed that it was growing a little, so that's when I told her, maybe we should go to the emergency room, get us checked out, get an opinion from a doctor and see what they tell me. So we did just that. Went into the emergency room. Got to see a doctor. At first he wasn't too sure what it was. He thought it was maybe I busted a blood vessel working out. So he started asking me, did you feel any kind of pop? I said, no problem swallowing, no pain. It's just a lump on my neck and I want to know what it is. So, like I said, he wasn't sure about what it was. Took me to go get a CT scan. Came back, said it looked like just like a blood, kind of like a blood clog. So he told me, take it easy at the gym. I want you to put ice and heat on it. See if that helps. Did what he told me. Took it easy at the gym. Ice, heat. Nothing. No kind of progress. Was still growing a little. So I decided to go back to the hospital about 3 weeks later, because I noticed it was getting bigger. So when I went in, same doctor saw me again. He went back to the CT scan that he took the first time I went in and noticed that it grew progressively. So he decided to call an ENT specialist to come in and kind of see what's going on. So when the ENT specialist got there, stuck a tube down my nose to look down my throat, see if there's anything crazy going down right there. He said everything pretty much looked normal. Nothing looks out of the ordinary. So then, after the doctor decided to go talk to some medicine doctors, they decided that they weren't going to discharge me, and they wanted to admit me to the hospital and keep an eye on me just to be safe, because they were worried that it was going to cause some kind of disruption with my breathing and eating and stuff. So they were kind of, they wanted to be cautious about it. So I stayed in the hospital that same night for the next 3 days. I was at the hospital. The next morning, they came in, they looked at my CT scans and told me that it looks like I have a tumor. So they wanted to do a needle biopsy. So the pathologist came in a couple hours later, did his biopsy, stuck a little needle down the mass on my neck and got some tissue out. Did a little test on the little microscope. He told me that he wasn't sure if they had enough tissue, if they were going to have to do a bigger procedure. So from the tissue that he got that day, he said that it looks like it's sufficient enough to, be tested and to find out what it could be. Got a call the next day, told me that it wasn't, that they wanted to schedule me for a core biopsy. So just go in with a bigger needle and go in a little deeper and take a bigger chunk out, so it helps them study it a little better. So I got that done 3 days later, actually the following week. It was the following week, I'm sorry, I'm pretty bad with dates, but yeah, it was the following week. Went in, they got that done. During the procedure, they would, go in with the biopsy, with the needle, take the chunk out, hand it to the pathologist. She would get under the microscope, look to see what she can see from what she's looking at as far as that moment. And that's when she pretty much told the doctors it looks like it's lymphoma cancer. So the doctor came to me, told me, and at first it kind of freaked me out, as far as it scared me a little, but at the same time it was like a relief, because I knew what was going on, and I knew that now, knowing what it is, we can take the next steps as far as curing this cancer. So a part of me was relieved. other part of me was kind of scared. So when I brought it up to my wife, it hit her hard because, nobody wants, their husband, being diagnosed with cancer. So, it hit her pretty hard, but I told her we had to keep positive. We have to think about, the kids, my daughter, and of course we have a son coming on the way. So, it's best for us to keep positive for the kids to kind of, not bring, the family down. So, yeah, it was a big relief. I still wasn't, given a final diagnosis. So part of me was kind of hoping that, maybe it wasn't cancer. So the doctors decided that they needed some more tissue to do more tests to confirm that it's cancer. So about a week after that procedure, I got scheduled for another biopsy, but this time they wanted to cut into the mass and take a chunk out. So I was put under, anesthesia. So I didn't really feel anything. I just remember waking up, 6 hours later and just feeling really like crap. So they took a chunk out, and this is what was left. Where they cut me in, nothing too crazy, nothing too big. From that procedure is when the pathologist, it took a couple of weeks to run the test because they had to do stains and stuff like that to confirm what it is, what stage, non-Hodgkins or Hodgkin's disease. So about 2 weeks later, that's when I found out that the pathologists were kind of leaning towards lymphoma cancer. They didn't want to give me a final diagnosis yet, so it was kind of, another frustrating part. But the doctor decided he wanted to push it up to the oncologist anyway, so we can kind of get started. Because if that's what they're really leaning for, then he wanted to get started as soon as possible, since luckily, I caught it early. So the oncologist, got a hold of my paperwork and stuff, and he wanted, to get started on everything. So that same week that I got told where the doctors were leaning, I got admitted into the hospital again. This time the oncologist wanted to run a bone marrow biopsy to see if the cancer has reached my bone. So I was in the hospital for another 3 days. They ran their test, didn't get the results till after my first chemo session, which I went through 2 weeks ago. And it wasn't too bad. I didn't have my port placed yet, so we did an IV in the hand. Nothing crazy. Like I said, it wasn't too bad. Felt a little sick, a little different, because I got some, medicine pumping into my system. After that day, for the next couple of days, it went by pretty smooth, feeling sick here and there, but they gave me some pretty good meds that would help with that. The following week, I got my pores placed in my chest, and pretty much, little incision, little square thing that sits under my skin. This is where I get the IV placed to access, my veins, so they can medicine goes in through here. There's a tube that goes up into my main artery. It's kind of crazy, sometimes I look at it and I'm like, wow, that looks kind of weird, but it's better than having it in my arm, so it won't mess up, the veins that I have on my hand. So today was the first day that today was the second session of chemotherapy. Went pretty well also, but this time we got to use my port. Felt a little nauseous, a little faster. Headaches, happened a little faster just because it's a bigger vein, so the medicine's, pumping faster through my system. Nothing too bad. But other than that, I've been feeling okay. Got back in the gym last week after having a whole month off. I was off for a whole month because I was just having appointments and surgery procedures that I couldn't lift. So like I said, luckily I got to go back to the gym last week. First couple of days were pretty rough, trying to build that strength again. Feel like I got to start from the bottom, work my way up again, but it's not a problem. I'll get to where I was before I got stuck with this. going pretty well. Like I said, pushing myself. You know, doctors also told me they don't want me to stop being active, but at the same time I got to be a little more precautious as far as, you know, not trying to push the weight that I used to push before, because it's not going to be the same. My bones are not going to be the same. Still have my hair, and I'm hoping I don't lose it. You know, I researched, you know, I've heard from doctors sometimes it takes from the first to the third treatment where you start noticing, you know, some hair loss. That's one of the big risks. My hair is thinning out a little, so I'm kind of noticing a little change in it, but it's still there. As far as my skin, it's a little paler. I have to be a little more careful when I go places. I have to wash my hands all the time, so I'm constantly like having to be really cautious, but at the same time I want to kind of live my life just being too worried all the time. I don't want it to hold me back from doing stuff, you know, with my daughter. So I'm going to be doing what I do every day, just, you know, a little bit more cautious. Still going to be hitting the gym, trying to get back in shape. It really helped getting back in there just because I felt more energized. I don't want to feel tired all the time, and that's something the doctors told me that's why they want me to keep, you know, keep active. So I'm going to push myself to get to that. As far as everything else, support from the family is really good. Actually, friends, hear from friends every day. My wife has been the biggest support. My daughter, just keeping me positive every day, just doing it all for her and my wife. They're pushing me. My wife's on me as far as medications. So I have a good group of people behind me supporting me, and I'm really grateful for that. I thank God for that. Also thank God for last week I got my bone marrow results and they were negative, so the cancer didn't reach my bone, which is a good thing. I get to stay at a stage 1 instead of stage 4. Medicines stay the same, they don't have to get stronger. So I'm hoping this treatment plan goes by pretty fast. Everything goes well. I'm on my second chemo session right now. I should be going through 4, and it's every 2 weeks. So next week I have a scan to see how my progress is as far as how the cancer is reacting to the treatment. So I'm hoping to get some good news. I also have an appointment with a radiologist about my radiation treatment, as far as just a consult, just to see if I have to do it or not. I'm hoping I don't, because, you know, radiation has a little higher risk. So I'm hoping, you know, I don't have to go through radiation, but we'll see. We'll see how that goes. I'm glad this, you know, lump went down. It was pretty big. I might post some pictures in the future just so y'all can see how big the lump was. But after my first treatment, it went down pretty well. So I'm pretty happy about that. But like I said, I'll be keeping y'all updated with how I'm feeling, how my treatment's going, just so if I'm not able to reply to your texts or anything, you know, you can find out through here how I'm doing. I'll make sure to keep all y'all updated, let y'all know if anything crazy happens, how I'm feeling. I'm not going to get too crazy as far as posting a video every day, because that's kind of weird. But yeah, thanks for watching, and y'all have a good one, and God bless. Y'all take care.